Hi, we're Reese and Matt from the Animal Rehab Clinic.
We're going to take you on a tour of the clinic and show you what we do here.
This is our initial consult room. This is the first room that all our clients come to when they first get to our clinic. This is where we will take a detailed history, do a thorough examination of the animal and come up with a rehab plan as to how we need to go about treating the condition that they've got. We also do class 4 laser therapy in here with our K-laser. Laser therapy helps to decrease pain, inflammation, help healing cells proliferate. Works really well with arthritic animals and anything that's quite acute, so we do that in here too. Let's have a look at the next room.
So this is our water treadmill room. We've got the water stored in the tank here, which is kept at a nice warm temperature. Got the pumps over here in the control system, and when we switch it on, it fills up from the bottom so it doesn't scare the animals. Now, by varying the water depth and the speed, we can change the impact that's going through the joints as well as the resistance, so we can help build muscle while minimising the impact on them in a controlled environment. The best kind of patients that are suited to this are your post-operative orthopaedic surgeries, where we need to get them moving as soon as possible in a controlled environment. Let's have a look at the next room. This is our rehabilitation room. We use this mostly for our post-orthopaedic surgery or neurological cases. We use a whole range of equipment around here, and usually the goals of this are to improve proprioception, improve movement patterns, or strengthen conditioning. A specific piece of equipment we use is this complex EMS or muscle stimulator, and we use that on dogs who are atrophied or having trouble with strength, and we can stick that on to help them recruit those right muscles while we're doing the exercises. We also do show patients how to do these exercises at home, and they can do that by either using some things around the house or purchasing some equipment from us.
This piece of equipment is our gait analysis treadmill. It uses a variety of metrics to create an objective report that we use on all of our initial consultations and then again at our progress reports to measure the success of our rehab plan. This is the software interface for our gait analysis treadmill. On the left hand side of the screen you can see this is a schematic of the treadmill as the animal walks on it. As you can see, each footprint is hit and identified by the software, and the amount of pressure that goes through each foot is measured. You can change the sensitivity while you're doing the scan on the left hand side of the screen if the dog's really heavy and you need to dull it down, or if they're really light and you need to make it a little more sensitive. The video part is synced up with the camera, so we can actually check that as the front left paw is hitting, it gets identified as on the screen as the front left paw. Down the bottom where all of these graphs are, there's 4 different colours. Each colour represents one of the feet and the peak pressure that goes through it. And what it does do is use a range of metrics to print out a really good objective measure in a report, so we can test how animals are on the first day and how they are when we finished our rehab plan. On this particular picture, we've got the forelimbs here, hind limb here, left on the left side, right on the right side. It shows how much is the peak pressure that goes through each foot, as well as an average of all the pressure that goes through and the size of the step. This is the gait parameters, shows front, back, step length, stride length, cadence, velocity. What we really want to see is symmetry in between the green and the orange and the blue and the purple. What we do is retest at the ends and compare to see if these measurements even out. It's got swing phase, stance phase for the front and the back, left and right, and once again you just want to see symmetry. This is the centre of gravity or centre of pressure. These are the forelimbs, these are the hind limbs, and this squiggle in the middle as if we were to hang a pencil off the middle of the animal's chest as they walk, and it would draw a pattern on the ground. What you generally want to see is a nice tight repeated pattern. In the middle you can see that there's a little bit of instability with this dog. It often should look like quite a tight figure of 8. Velocity and density are just another way of measuring the same thing. It's just how quickly they move from left to right. We can see there's a very quick movement from right to left, from back to front on this particular scan. We use all this data to, not as a diagnostic machine itself, but to create part of a clinical picture so we can come up with a rehab plan and assess very objectively how far we're through it and how successful it's been.